Hi friends, welcome to our YouTube channel, One and Only Pharmacy. So friends, today's lecture we are discuss about pharmacology chapter, sympathomimetics or adrenergic. So friends, I request you to all please watch this video till the end. Let's start. Topics cover under this chapter. Which topics we are discuss about today's lecture? These are follows a definition of adrenergics or sympathomimetics, classification of sympathomimetics, catecholamines, mechanism of action of catecholamines, pharmacological actions of catecholamines, and detailed study of adrenaline, and definition of nasal decongestant and its example. Let's see one by one in detail. Definition: sympathomimetics or adrenergics. These are the drugs which produce actions similar to that of sympathetic stimulation. These are the drugs which produce action similar to that of sympathetic stimulation. Example: adrenaline, noradrenaline, ephedrine. These drugs contain amino group, hence they are also known as sympathetic amines. Next point, classification of sympathomimetics. These are very simple classifications according to the structure and according to therapeutic uses. In according to structure, they are classified into two types. First one, catecholamines, and second, non-catecholamines. In catecholamines, this class of sympathomimetics contains catechol group. Example, adrenaline, noradrenaline, isoprenaline, etc. And in non-catecholamines, this class sympathomimetic does not contain catechol group. Example, ephedrine and amphetamine. This classification based on according to structure. Next point, according to therapeutic uses. Adrenergic drugs used for raising blood pressure. Example, noradrenaline. Those giving inotropic actions on heart. Example, dopamine and isoprenaline. Those drugs used as a central stimulants. Example, amphetamine. Those drugs as used smooth muscle relaxants. Example, adrenaline, isoprenaline, and salbutamol. Those used in allergic conditions. Example, adrenaline and ephedrine. Last one, those used for suppressing appetite. Example, fenfluramine. These are the classification based on according to therapeutic uses. Next point, catecholamines. What is catecholamines? The catecholamines include sympathetic neurotransmitter adrenaline, noradrenaline, dopamine, and the synthetic compound aspirenaline. Catecholamines content of adrenal medulla normally is 85% of adrenaline and 15% of noradrenaline. Mechanism of action of catecholamines. Mechanism of actions of catecholamines. The catecholamines produces their action by binding with alpha and beta receptors located on the cell membrane. The outcome of this drug receptor combination is either an increase, means excitation, or a decrease, inhibition in the tissue activity. The alpha receptors are excitatory and beta receptors are inhibitory in nature. The alpha receptors are excitatory and beta receptors are inhibitory in nature. Beta receptors are predominantly present in heart and are excitatory in nature and are excitatory in nature. Their stimulation increases the rate and force of contraction of myocardium. Similarly, both alpha and beta receptors of GIT are inhibitory in nature. Their stimulation produces a relaxation of smooth muscle of GIT. These are the mechanism of actions of catecholamines. Types of adrenergic receptor. There are two types of adrenergic receptor, that is alpha and beta receptor. The affinity of these two receptors are as follows. For alpha receptor, adrenaline is greater than noradrenaline is greater than isoprenaline. And for beta receptor, adrenaline is less than noradrenaline is less than isoprenaline. Second point, pharmacological actions of adrenaline. Actions on CVS. What is the pharmacological actions on adrenaline on CVS? That is heart. Heart predominantly contains beta receptors. Adrenaline gives positive chronotropic and positive ionotropic effect by binding with beta receptors. The isoprenaline is more potent as compared to adrenaline. Blood vessels and blood pressure. Adrenaline causes the vasoconstriction of coronary blood vessels by binding with alpha receptors and it leads to increase in blood pressure. Action on smooth muscles. Under the action on smooth muscle, there are also subtypes. Bronchi. Adrenaline is a bronchodilator. It causes dilation of bronchi. Adrenaline is used in the treatment of bronchial asthma. B. Gastrointestinal tract. It causes a decrease in peristaltic movement due to relaxation of intestinal muscles. C. Action on metabolism. Adrenaline increases glycogenolysis. This action leads to increased production of glucose units, which may lead to hyperglycemia, that is increase in blood sugar level. Second, under the action of smooth muscles. Fourth type, action on eyes. Adrenaline produces mydriasis, that is increase in pupil size, by producing the contraction of radical muscles. Last, action on uterus. The action of adrenaline on uterus depends on the state of the uterus. In non-pregnant women, it causes contraction, and in case of pregnant women, it causes relaxation of uterus during pregnancy. ADME means absorption, distribution, metabolism, and excretion, means pharmacokinetic of adrenaline. Adrenaline does not get absorbed from GIT, hence it does not administer orally. It is administered parenterally. The adrenaline gets metabolized in the body by two enzymes, that is MAO and COMT. MAO means monoamino oxidase enzyme and COMT catechol O methyl transferase. Contraindications of adrenaline. Adrenaline is contraindicated in hypertension and angina pectoris. Therapeutic uses of adrenaline. Adrenaline is a life-saving drug. It is always present in the emergency kit of physician. It is used in the treatment of bronchial asthma. It is used in the treatment of anaphylaxis, means allergy condition. It is used as a nasal decongestant. It can be used in the treatment of hemorrhage, for treating the overdose of insulin, for restoring heartbeat, and last use of adrenaline. It is used as a muscle relaxant. Adverse effects of adrenaline. There are following adverse effects of adrenaline: anxiety, fear, hypertension, tachycardia, palpitations, tremors, restlessness, throbbing headache, etc. These are the some adverse effects of adrenaline. Nasal decongestant. Sometimes in question paper ask the question like define nasal decongestant and give it simple examples. What is nasal decongestant? These are the drugs which produce a prompt, prolonged, and reliable effect so as to clear the nasal congestion. Example: ephedrine, hydrochloride, adrenaline. Ephedrine, hydrochloride, adrenaline. See the chapter once again from start to ending. Friend, please like, share, and subscribe to our YouTube channel for pharmacy related daily updates. Sympathomimetics another name is adrenergics, pharmacology chapter, D Pharmacy second year, presented by one and only pharmacy YouTube channel. Topics covered under this chapter: definition, classification, catecholamines, mechanism of action of catecholamines, pharmacological actions of catecholamines, a detailed study of adrenaline, and last one, nasal decongestant. Definition: these are the drugs which produce action similar to that of sympathetic stimulation. Classification of sympathomimetics. Classification is based on the according to structure and according to therapeutic uses. In according to structure, there are two types based on catecholamines and non-catecholamines, means presence of catechol group and absence of catechol group. And therapeutic uses, catecholamines, content of catecholamines. There are 85% of adrenaline present in catecholamines and 15% noradrenaline. Mechanism of action of catecholamines. It is based on the receptors present in the cell membrane. The alpha receptors are excitatory and beta receptors are inhibitory in nature. Types of adrenergic receptor. There are alpha and beta receptors. Action on CVS, heart, blood vessels. Action on smooth muscles. Under the smooth muscles, bronchi, gastrointestinal tract. Action on metabolism. Action on eyes. Action on the uterus. ADME of pharmacokinetic of adrenaline. Adrenaline does not get absorbed from GIT, hence it does not administer orally. It is administered parenterally. It is metabolized by the two enzymes monoamine oxidase and catechol methyl transferase. Contraindications: adrenaline is contraindicated in hypertension and angina pectoris condition. Therapeutic uses: adverse effects of adrenaline, nasal decongestion. Thank you, friends.